to another week of the Rev MD podcast. This week, we're going to talk about all of the alphabet soup when it comes to medical billing in the world of EDI and EFT arrangements. And if you're like many physicians and you're thinking, I don't know what those words are, or I know what EFTs are because that's how I get paid, but I don't know what an EDI enrollment is or what I'm supposed to do with that, this is the podcast for you. If you are new to the podcast show, this is coming to you from National Revenue Consulting. We are a full-service medical billing and coding company. You can check out our website at nationalrevenueconsulting.com, where we have client testimonials and even a free assessment tool you can head over there and take, which gives you kind of some ideas around the health of your medical billing in your practice. We help physicians with a full service medical billing and coding team that really helps define processes, understand what's going on, and provide a reliable and data-driven service so that your revenue can grow. So head on over, check us out. Happy to set up a call if you are looking for a new team. We only have a few more spots for the rest of the year. Actually, really even just a few more weeks left before we stop taking new clients until 2024. So this week, we're going to talk about EDI enrollments and EFT enrollments because these types of processes are going to improve the operational efficiency and they're going to reduce administrative burdens, both on your billing team and also your front office staff. And so it's extremely important to understand what these are. And if you don't already have these in place, get moving on getting this set up with your clearinghouses. So first and foremost, what is an EDI enrollment? So this is the electronic data interchange. And EDI enrollments is basically a standard method of exchanging business information electronically. And that can be things like claims, remittance, eligibility inquiries, all through the clearinghouse and connecting it to your individual payers. So EDI basically is going to be the process to streamline communication between your office, your providers, the payers, and really provide the benefit of as much as you can automating that claims process. And so it can do a lot of things for your practice, right? It can reduce administrative costs because you're decreasing the need for manual data entry. You're decreasing paper-based communication, which is extremely time-consuming and, of course, going to be prone to errors. EDI basically automates these processes so that you can spend more time managing your practice and less time dealing with paper. And it's going to allow faster claims processing. It basically accelerates that submission of processing of your claim, leading to that quicker reimbursement. It's going to improve accuracy because you're not writing things down or submitting paper claims. And actually, some payers just flat out don't allow paper claims anymore, like Medicare. And so you have to do the EDI enrollment. And of course, it's going to allow safer data security, which we all understand. And so an EDI enrollment is something that when you're changing a software, you have to think about, or when you're setting up a new software. And EDI enrollments in general, when you're connecting, again, that software through the clearinghouse to the payer, because that's what you're doing here, can sometimes take 30 to 45 days. A lot of times this comes up in a software transfer because when the software gets set up for the first time, maybe the software was doing it for you, or maybe you had an office team member who did that and you weren't even aware that that was happening. So the EDI enrollment can also come into play when you're transferring softwares. So say you have a software and they have the EDI enrollments through their own clearinghouse, and you're changing softwares to a new PM software, and they have a new clearinghouse, then you have to get the list of your current payers and make sure that those EDI connections with your new software are set up. And again, those take time. And some of the struggles are that you can't have two connections live at the same time. And so this is where it becomes a little tricky in terms of timelines. Because say for Medicare, for example, you can't have two connections through two different clearinghouses, through two different softwares at the same time. So you have to turn one off and then turn one on. And there's a delay there of sometimes a couple of weeks before it's live in the new system, where the team may have to submit claims manually through a payer portal or get electronic remittance. So that's those electronic EOB information back so that you can post payments. And luckily, when you are moving and transferring EDI enrollments with, say, a software change, it doesn't stop money from flowing. So if your EFTs, which we'll talk about in a minute, are set up, then your EFT, the money part, will still continue, will hit your bank account. But the manual process of either claim submission or getting the information back so that you can post payments is a little tricky. And so you really want to coordinate with your billing team that this gets done well and gets done right. And a lot of these also have to be done in partnership with your office manager, because the billing team is a third party potentially. And so if they are a third party like we are, we don't have the rights to submit all of the EDI enrollments with just our team. So it has to be in partnership with the office manager, and that can get tricky. And so when you are doing a software transition, really has to be a partnership between the office and the third-party billing company, or even your in-house billing team. There just has to be really a good, solid plan, coordinated effort, plan ahead, 30 to 45 days sometimes for those EDI enrollments. All right, EDI enrollments, super important. Got to get those done. If you have a software where EDI enrollments aren't set up for everybody, got to get those done. It helps your billing team. It helps your claims processing, helps the front end. It helps the back end. Very, very important. Again, EDI enrollment stands for electronic data interchange, and it is that connection between your office, the software, the clearinghouse, and the payers. And information can flow front and back. Next on our list is EFTs. Electronic funds transfer is what this stands for. And this is about getting funds directly from a payer's bank account to a provider's bank account. And in the healthcare industry, EFTs is commonly used to receive payments from insurance companies and potentially even patients. And so EFTs are obviously going to allow for faster payments because it's going to eliminate the need of paper checks, reducing the time it takes for payments to reach your bank account. There's going to be cost savings associated with that because obviously check processing or those virtual credit cards can be costly in terms of how to get those processed and into your bank account. It's going to improve cash flow and, of course, improve security because you're not waiting on paper checks or losing a paper check. It's going to also improve your ability to reconcile because if you're getting electronic deposits, you know those are coming in, your team can post those, and you have electronic records of all of that. So this helps your front office because they're not dealing with paper checks. It helps your billing team because they're not having a delay to post and work denials. So this really just helps improve the entire process. Now, I do recognize some of those smaller secondary payers don't allow for EFTs, but that's getting more and more infrequent. So setting up EFTs is really going to allow, again, that smooth flow of money. And you can even think about this in terms of patient payments and setting up and getting a credit card processing team in place so that you're not dealing with paper checks on their end. And I really highly encourage, if you don't already have a really solid credit card processing team, reach out. We have some recommended vendors, one of which is Dr. Jennifer Mogan's team through Park Place. And so she's amazing and happy to connect you guys if you don't have that. And while that is, obviously different than an EFT, it is kind of just that electronic processing of money, which is just going to help your practice, again, be more efficient. So in today's day and age with paper statements and getting patients to pay, the more you can make it easier, a text message, an email, a push here for payment, even holding credit cards on file, all of those things are going to allow your revenue stream in your office to be better. Last but not least, let's kind of talk about the benefits of EDI and EFT enrollments. So again, we talked about cost reduction, right? So implementing both of these can significantly reduce the costs associated with paper-based billing, waiting for payments, mistakes. And so you're going to see cost savings there. Efficiency is probably the most important. So you're going to see automation through those EDI streamlines, claim submission processing, the ability to not have to have paper EOBs scanned. You're getting all of that information into the system itself. And then EFTs are going to ensure that those payments are deposited directly into your bank account so that there's no manual reconciliation. You're not waiting for paper checks. You're not scanning paper checks, all of that process. In addition, faster reimbursements. You're going to see that EDI accelerates claims processing, which means you're going to receive payments more quickly. You're going to improve practice cash flow. Obviously, we talked about enhanced accuracy and security because these both allow for reduced risk of data entry errors if you're doing anything paper or anything manual. Hopefully not today. That's really just got to be something that is just removed from your practice's process. And then obviously these are very secure methods of data exchange and payment transfer. So last but not least, how do you enroll in EDI and EFT enrollments? So a lot of this is going to be either through your clearinghouse. So TriZetto, Change Healthcare, Waystar are some options. Sometimes you have to connect with the payers directly. So you're going onto the payer portals, you're getting the necessary enrollment forms and instructions, and you're submitting those. These are tedious. There's just no really good way around it. If you are doing the EDI enrollment, you're going to have really careful attention to filling out the forms, making sure that you have the right W-9 information on file, your EIN information, your MPI information, all those things in one place so that your team can fill those out accurately. And they are going to ask for information regarding your bank account details. And so this is a very detail-oriented process. So you need somebody very detail-oriented to take care of these. Obviously, you need to be credentialed before you can set these up because they're going to ask for information that comes from your credentialing process. So get credentialed. If you're not credentialed, if you're a new practice, getting credentialed is kind of step number one. Then once you're credentialed, you can get these EDI and EFT enrollments all set up through your clearinghouse. Again, that's typically utilizing the software that you have planned to use for your billing process, using the clearinghouse, using the payer portals. And then once these enrollments are approved, then you're going to get instructions on how to further connect that with the software. You can make sure that these are connected appropriately with your software vendor. And a lot of times when you're moving to a new software, setting up a software for the first time, your software vendor is also kind of helping you manage this process and connecting you with that. I know TriZetto does a pretty good job with really making sure that all of these steps are in place and making sure that you're set up for success. And last is you're going to want to do some testing of your EDI system so that you can make sure that claims are going through. The last thing you want to do is submit 150 claims and know they all failed. So you kind of do a test claim with your payers, make sure that the connection's working, get a green light, and then you can kind of start letting open the floodgates. And then, of course, once those test claims have been submitted, then you can start submitting claims and receiving payments electronically. In conclusion, implementing EDI and EFT enrollments is going to be such a strategic move that can lead to cost savings, increased efficiencies, and faster reimbursements. All in all, one of the most important things you can do if you're changing softwares or if you're looking at your process today and going, gosh, I don't have these set up, I need to get these set up. Really, really important. And I know that when our team comes into a new practice, this is one of the first things we're looking at and really understanding, okay, how do we optimize the technologies and get that secure and reliable method for processing claims and receiving payments set up. This, again, reduces administrative burdens and really just allows your practice to focus on providing quality patient care, and it allows your billing team to focus on AR and denials and not paper manual processes that can slow things down. So get started, really work with your payers, complete the necessary enrollment forms, and really kind of be very detail oriented and follow those instructions because they can fail. They'll come back as denied if a MPI number isn't in right or if an address isn't in right. So very important to have these done right and well, and have somebody kind of micromanaging and resubmitting those if they do get denied, which is common. So last but not least, if you are interested in a new medical billing and coding company, head over to our website, nationalrevenueconsulting.com, and hope you enjoyed this episode, and we'll see you next week. Thanks so much.